your host, Patricia Trim. Welcome you to another edition of Tots and Teens in Focus. My guest today is no other than Dr. Sarah Marshall from Downstate Hospital. She'll be giving us so much inspiration, and she'll be talking about men and their feelings, their inner self, and what they have within them, and how they feel, men, and to let them know that they are aged and they can't come back to be a baby again. They're once a man, twice a child. So, Dr. Marshall, thank you for being on with us. Thank you for having this opportunity with us to educate our fathers, educate our grandfathers, and educate our young men too about their life ahead of them. Welcome once again. I know you're not a tot or a teen, but you're just right for the occasion.
Thank you, Ms. Trim. As always, I feel like a tot and a teen when I'm speaking on your show. And yes, I've prepared a little information for this occasion, and I choose to title it Social Determination of Health, Impact on Loneliness Beyond the Pandemic.
Oh.
So,
blame it on the pandemic, men. Blame it on the pandemic. Whatever is going on in your life, just blame it on the pandemic.
Right. They may blame it on the pandemic, but the social determinant of health was one of the things that has been around, and maybe with the pandemic, it highlighted those areas that we were not aware of before. So my objectives for today would be to identify social determinant of health, impact on loneliness, and to discuss preventative strategies and available resources on an individual or community level. So, although the COVID-19 pandemic has impacted everyone, the social determinant of health related to access and equity was highlighted, which included an increased loneliness. So let's look at social determinant of health. It may be defined as conditions in the environment where people are born, where they live, where they grow, work, play, their faith-based organization where they worship, and age. And there are 5 areas that are included: economic stability, educational access and equality, healthcare access and quality, neighborhood and built environment, and also social and the community. So if we would then look at, for instance, the economic stability, we're looking at income, and they may be in terms of what your income is, and we will talk a little more about that. If we look at physical environment, then we look at housing, transportation, we look at safety, we look at the park, we look at playgrounds, we look like walkability and the zone. And yes, sometimes people are then placed into certain category based upon their zone, or based upon, one of the things that I learned some time ago is according to your social security number, and that has an impact. Education. If you live in an area, a deprived or socially determinant area, you may not have equity in education. So therefore, your educational level, your childhood education, like with areas they have Head Start and different programs. If you are in a deprived area, you may not have access to that. And you may not have vocational training or high school that's equivalent. Food, access to healthy options, and the community. Social integration, support system, community engagement, so where you can engage in different programs. Healthcare system, health coverage and providers. And we will also go back into that because during the pandemic, those people who was in a social determinant area, they did not have access to perhaps a smartphone. So therefore, if they could not get to a facility, because remember, there was isolation. So therefore, they did not have continuity in terms of care, or their health care provided as if they were in an area that wasn't socially determinant in terms of health care.
So does healthcare plays a more important part in your social development if you don't have these things that you is essential? How would you be able to get these things and you don't have the technology, or you don't have the social environment of having the need that you need for your life?
Well, that's why Healthy People 2030 working on plans so they can eliminate or improve in terms of health care. But also what can be done is policies can be changed in order to improve accessibility in terms of healthcare. And when you look at the determinant of health, if you're looking at access to appropriate foods, in the past, we spoke about having fresh foods. So if you do not have access to fresh food, or you then would use the next thing would maybe be frozen food. If you don't have frozen food, then you use canned food as a last resort. But if you do not have any place to prepare that food, so how can you then have the food that you really need when you may live in a housing that is not equipped with running water so that you can then practice safety and things of that nature?
But canned food is not really healthy because the chemical that's in the can affect your body.
I agree. But remember, we didn't say canned food. We said canned food as a last resort, as opposed to not having any fruits and vegetables at all. The priority would be the fresh fruits and vegetables. But in some of the socially deprived areas, they do not have access to fresh fruits and vegetables. Or if there is availability, the prices are so high, they cannot afford it. Or they cannot afford transportation to go to the area where they can get fresh fruits and vegetables. So we're saying, if you do not have access to fresh fruits and vegetables, which you should have 5 to 7 servings a day, then you would try the frozen food. If you do not have access to the frozen food, then you would have tried the can, because the can, yes, has a lot of chemical. And what you can do with the canned vegetables, you might want to rinse them. So that would rinse out some of your chemicals and rinse out some of the sodium that might be for preservative in the canned good foods.
That is when you're really aged and you can't cook at all, or you can't do anything. So that you reserve to canned food because, you know.
Well, not just those who are aging. It may be because, remember, we say the social determinant of health has to do with where you're born, where you grow, where you play, where you attend church. So you may not necessarily be of age, although the thought is that as we get older, sometime our financial income is such that we cannot afford certain items or necessity of what we really need. So it doesn't have to do necessarily with the aging. It may have to do with you from birth.
I want to say something. During the pandemic, they were bringing meals around to people, and they brought meals. And when I saw it, I told them, I said, that is not anything good for anybody to eat, because it didn't look good, it didn't prepare well. And I mean to say they were giving it to people that said, well, I am strong and I can cook. But what about those elderly folks who can't do anything? What you're giving them here is not right. It was awful. I won't eat it.
Well, that's why you need advocate for everyone. And you need to have systems that are monitored.
But we got to speak out. I speak out. Right. Even when I think I was at the emergency and I was there all day, they brought something to me. I said, what is this they bring to people at the hospital? Oh, yes. And I came on my program and I talk about it. And I went back sometime there and they brought something because I was in the emergency. And I said, oh, they changed. It's not like what they used to give you. So that is why when people go places and they see things like that, they have to speak out, because no system will know that something is wrong unless you tell them. I did call them and I told them about what they give me. I said, that is not good for people. I said, I am strong, but what about the elderly folks who can make no move or do anything? You just bring this thing like, it's worse than dog food. The lady laughed, but they changed it up afterwards.
Well, so that's why also, Miss Trem, thank you very much for speaking up. But I would think in a hospital that you would have your healthcare providers, especially your nutritionists and those who are supervising, to make certain that the food that is being prepared is appropriate. Because also, as you said, it's not appealing, but it may not be the constituent that an older person can consume.
But then if they don't speak out, because a lot of people may take the plate and put it down and don't say anything and say, well, I'm not eating that, that's not good. But then we say there, but we're not speaking out on air. If we speak out on air, things will change.
Well, or also you speak to those who are in charge. Like, for instance, now that I'm hearing you say that, I'm going to take a closer look at the facilities that I come in contact. And you are probably, you are correct, 100%. It just was brought to my attention. I visited a patient in a nursing home yesterday, and that person was there for rehab because they had back surgery. And they had given the person some meat, and meat is not a part of that person's diet. And so the person looked at it and said that this is not my diet. And so the healthcare provider said to me, on Tuesday, the nutritionist will come and they will be able to select what they want. So I looked at them and I said, today is Sunday. Are you telling me that this patient has to eat or not eat because they cannot consume these food because they are not, it's not a part of their diet to have meat? Are you telling me that they are not to eat anything until Tuesday?
Mm-hmm.
I don't think that that is correct. So what you either do is you either call up someone who is in charge and have them look at an alternative to make certain that this patient and all the patients are getting food according to their culture or according to their religious belief. And yes, that is definitely needed, Ms. Trem. It needed in terms of the type of food that is being prepared, is needed in a mannerism that the food is being prepared. One should prepare the food as though they would be eating it, or the ones that they love would eat that food. And not just to prepare something.
I think they got to take more concern about the elderly folks in the nursing home. I know it's just like the home health aide and they don't pay much attention to them. Another thing that the elderly suffer in the nursing home, they have on wet pampers from morning until night, and they put them to sit down there.
Oh, that's another thing. The reason I happened to have gone to that particular rehab center was because this person's daughter called me, and the person had told their daughter to call me because they were in a pamper from 5 a.m. and I arrived there around 12. So from 5 a.m. till 12, they were in a wet pamper, and they had it very securely tight. And what they said to the person who was alert and told them that they wanted to use the bedpan, they told them to urinate on themselves. And when they did, they never came to change. So the person was not only saturated with urine, but the bed and the dressing. And when I did an assessment of the patient, I noticed that there was some retin area, which means that that is an area for breakdown. And that is not acceptable, because that could cause the death of an elderly person, or a person who does not have anyone to come and check them.
And those are the people that don't have anyone to come and check them. Those are the people who suffer because the home health aide or the CNN don't care. And this is a thing that they should really tell you, you're doing the job, do it right, because you're paying you. If you feel that the payment is not good enough, then leave the job.
Exactly. And that brings us back to, that's why those patients who do not have anyone to take care of them or to speak for them, they are very lonely. And so we sometimes, all of us feel lonely, but loneliness, when it becomes intense, it has negative influence on our lives, such as it increases the risk of death, because a person who is lonely and feel that they do not have anyone to look out for them, they may then refuse to eat. Like this person could have refused to eat that food, and not eating had an impact, negative impact on the healing of the surgery. And also another thing, that the physician should have also been engaged in that kind of a situation. And so with those patients that are lonely, it increased the risk of mental health. And studies have shown that 60% of people who are lonely experience mental illness, as opposed to 15% of those who do not, or who are not lonely. And these patients these people have a lack of confidence in themselves. And therefore, you find that they may have conditions such as high blood pressure, which is a silent killer. And therefore that increase. And then you also find that they do not sleep adequately. And even though we're getting older, just because we're getting older doesn't mean that we need less sleep. We still need at least 8 hours of sleep a day. So when we look at types of loneliness, emotional loneliness, lack of meaningful relationship, that's what we have sometimes when we don't have a relationship with anyone else. Social, we do not have a connection with anyone. And the existential feel of separation from others and the wider world. For instance, COVID-19 pandemic impacted the older population because they could not go outside. They were inside their homes, and therefore they were not getting, maybe they were getting food on wheel, but look at the food that you just described. The food was not appropriate to eat. So that made them even more lonely. So social loneliness, they find that the highest prevalence for loneliness and isolation among people, if they're physical or mentally, if they have disabilities physical or mental, financial insecurities, and many of us, even if we're working, we are financially insecure because we're living from one paycheck to the other. And because of that, we will feel a little lonely. So those who live alone, single parents, as well as younger and older population, and although the highest rate of social isolation are found among older adults, guess what? Teenagers or young adults are almost twice as likely to report feeling alone than those over 65. So the rate of loneliness among young adults has increased every year since 1976 and through 2019.
Mhm.
Now, social loneliness, lower income, as we said. And what is lower income? Those who probably have an income of $50,000 or less are considered, which is 10% point higher than those who are more than 50%. So if you are making $50,000 or less, you are 10% more likely to be lonely than those who are making 50,000 or more a year, because the cost of living is really extremely high, especially in Brooklyn. I'm working every day and I cannot afford the housing within my working area. So therefore, you find that people cannot afford to live in these areas, and that makes it even more. And ethnic and racial minority groups, they suffer more than the others, because sometimes the system, would you believe, the system has a built-in bias and prejudiceness for people of color. And it's like there is a dual role that they play, one for those who may be of color and another for those who are not. And so that brings us to try in terms of making equity. And that's one of the 2030 goal, is to work on making equity for those people and equity for all. Because just to have, and there's a difference between equality and equity, because when you're looking at, you may be separate, but then you don't have equity. So, and that's a misdemeanor, because they say sometimes in schools they have equity, but no, they do not have equality. So we want to then look at that from that perspective. And men suffered more from loneliness during the pandemic than female, because the men usually socialize. If there's an event, you find men, they will navigate towards each other and they will socialize. Females seem to be a little bit clannish, and they will select whoever they decide, but not necessarily socialize with everyone. And that's why you find that men suffered a great deal of isolation and loneliness during the pandemic. So, as we said, conditions associated with loneliness is high blood pressure. So, conditions associated with determinant of health, which mean you don't have proper food where you live. So, you may eat fried food, as we mentioned once before. You may eat the fried food as opposed to the broiled, bake, or stew. And therefore you may eat food from fast food that may have high sodium. Although it should be labeled, the content, it may not always be. And that's why you find a lot with people of color, they have obesity because they may have determinant of health, and the fast food or those fried foods, they are cheaper. So they tend to eat that more.
Dr. Marshall,
Yes.
what causes men to have these big, high gut? It's so high that, you know, what's inside there that you're having this big, high gut? Is it a growth?
Well, as men, as we all get older, you find that female have that as well. It's how the shift in the anatomy and in the digestive system that causes the fat in the system to kind of like rise in that particular area, in the abdomen area. So it's
what rise in there? The gut, or just it just
it's the fat. It's kind of pooled in that area, and that's why you have a lot of people who get diabetes. Diabetes is one of the things that they would get, and because of where the fat shift in that, or the digestion or the circulation shift to that particular area.
Oh. Men, I hope that you've taken in this talk, because it is very important for your health, and your health is responsible for your body, and your health is responsible to keeping you alive, alert, awake, and enthusiastic. Men, there's a lot of things that goes on, and in men's body, you see the stomach. Thank you, Dr. Marshall. I know this educational theology of your medical history and what of men, both men and women, and what it can do for them, with your input and your voice out there in the community, we're able to bring strategic help to those who got egoism, who may be young men, who will be fathers, and who the ones that don't care what they do, whatever they do, they think about, you know. So this is very interesting to let men know the calamity, especially the calamity of, all the men know the calamity of making a child at such a older age, and they say you will take it up in a topic, in older age, to disable or disfranchise a child life in the older age. A child will not be of any good for themselves, but they will be a burden to society and a burden to the parent who will have to take care of that child. So I'm glad that this discussion was being said, and I thank you very much. And I do hope to get you back on some other topic, because I know your ideology is very good, and also your theology of training nurses and doctors, and training in the department of Downstate Hospital, that you help all people. Thank you once again for being on Tots and Teens in Focus and Circle Dynamic Women of Power, and hope to see you at our health fair. Thank you very much.
You will.
That was Dr. Sarah Marshall from Downstate Hospital, giving us an overall view of the life, the egoism of men, the social life of men, and what causes them to be there. Even when you have the big tummy, we talk about that. So you men, listen, so you can be able to correct those big tummy that is coming out because of overeating things that is not supposed to be in. Thank you very much, Dr. Marshall. See you sometime later.
Thank you.
And thank you all for being there as our viewers on Tots and Teens in Focus and Women of Circle Dynamic Women of Power on our broadcast on Brick Art Media. Thank you and goodbye.